Now coming to atrophic rhinitis. Atrophic rhinitis is the form of chronic rhinitis which is associated with atrophy of nasal mucosa, mucous gland, nerves and vessels. So there is a atrophy. There is a complete destruction of nasal mucosa, mucous gland, nerves and vessels. Now these atrophic rhinitis are of two types: primary atrophic rhinitis and secondary atrophic rhinitis. Primary atrophic rhinitis is due to the metaplasia, that means a change of one type of epithelium to another type of epithelium, that is pseudostratified ciliated columnar epithelium, which is normally present in the lining of the mucous lining of the nasal cavity, which is changed into stratified squamous epithelium. Also, there is obliterative end arteritis and terminate hypertrophy. Now coming to secondary atrophic rhinitis, it is due to the destructive granuloma formation, that is due to sarcoidosis or leprosy or rhinoscleroma or SLE, systemic lupus erythematosus or syphilis. What is the cause of primary atrophic rhinitis? The mnemonic is hernia, H for hereditary cause, E for endocrinal cause like estrogen deficiency, R for racial, that is white and yellow races are mainly prone to atrophic rhinitis, nutrition deficiency, vitamin A, D and iron, infection like Klebsiella ozaini is the main bacteria which causes the infection, or diphtheroid bacillus, and the autoimmune cause. Now the on clinical features we can find that there is a roomy cavity inside the nose. The nasal cavity becomes roomy, so excessive crust formation and loss of sensory nerve. Due to this loss of sensory nerve, there is a anosmia. So there is anosmia, patient cannot smell anything. Foul smelling discharge is found from the nose due to this crust formation. Removal of this crust leads to bleeding. So due to this obliterative endarteritis, there is a pale nasal mucosa. There may be association with atrophic laryngitis or pharyngitis, atrophic pharyngitis. What is the management? So three things we have to follow. We have to remove the crust, we have to treat the infection, and we have to prevent the further crust formation. So how to remove the crust? By nasal douche, that means 2:1:1 ratio of NaCl, sodium bicarbonate and sodium borate in 280 ml of saline water, and 25% glucose in glycerin spray. How to prevent the infection? By chemicitin solution, which contains the mnemonic is COPD, that is chloramphenicol, which is an antibiotic, estradiol spray, because estrogen deficiency causes the atrophic rhinitis, so estradiol spray, propylene glycol, which will lose this crust, and vitamin D2, because vitamin D deficiency causes the atrophic rhinitis. So vitamin D2, so together it is present in the chemicitin solution. Now prevent the further crust formation by potassium iodide spray or estradiol spray. We can do the further surgery like Young's operation, where the mucus flap from the lateral side and the medial side, that means lateral wall and the medial wall, both mucus flaps are removed, and these are sutured totally to make the cavity closed. But it is found that after a few days the patient complains of nasal obstruction. So there is a 3 millimeter gap which is made, and it is known as inside that flap, inside the sutured flap. So this is known as modified Young's operation, and also we can do Lawton-Seager's operation. So this is all about the atrophic rhinitis.